So, of course, what is the measurements for men and women? What do you tell your patients in the office comparing? I mean, measuring body mass index is very difficult. So, is there a quick formula as far as what is your waist size should be for men and women?
Yes, a very easy, simple method. If you just have a cloth-type measuring tape at home, just simply place it around, your bare midriff, slightly above the belly button area. And when you take the measurement, you want to exhale out and then record what that measurement is. And if you're a woman, the waist measurement should be no more than 35 inches. If you're a man, the waist measurement should be no more than 40 inches. So you want it below 35 for a woman, below 40 inches for a man. And if it's a number higher than that, then it probably does indicate visceral fat.
Okay. Are there any other risk factors, Cheryl, besides diet that can lead to big belly fat? I mean, there are people probably out there who are saying, look, I do everything I'm supposed to be doing. I eat healthy food, and I still have this belly fat. And the rumor about like drinking a lot of beer and alcohol, is that, or are there any other risk factors besides diet that people should be aware of?
Yes, definitely. One of them, and this is something we can't control, but age. As you get older, we just naturally become less active, and we also don't need as many calories. So unless you are still being physically active and you're watching your caloric intake, it can be quite easy for a person to start putting on some weight. Gender-wise, we know that it can affect men and women a little bit differently. Women tend to have more of that subcutaneous fat, which is the fat found directly underneath the skin. We tend to carry our weight more on the hips, thighs, and buttocks area, the upper arms. But then when a woman goes through menopause, the estrogen and progesterone levels drop, then that causes us to actually start gaining more weight in the midsection or that visceral fat. Men tend to have less amounts of the subcutaneous fat, and therefore then they have the more of the visceral fat. So for a man, when he gains weight, it's almost always going to be in the belly section. You see very few men who have weight on their hips, thighs, and buttocks like women do. So that's where you tend to see men gain that. So that would be another cause. People who smoke, smokers tend to have more visceral fat. You can be somebody who smokes, and a lot of times women will take up smoking because they feel like it keeps them thinner. It's not a healthy way to do it, but that's what they do. But then they end up with more of that visceral fat stored deep within the belly there.
How about the thyroid disease? Does that play a role? I'm just asking. Some of these patients that are hypothyroid, is that a general weight gain, or that's also like a belly fat kind of?
Well, it can be probably a little combination of both. If you have a low thyroid, hypothyroidism, you're going to have a tendency to gain weight. You feel more sluggish. You may not have the get up and go to you, the energy levels to want to go out and exercise much. So, you probably will gain more of that deep within the abdominal area then.
Okay.